There is no shortage of concern about how fast AI is growing, from job losses to privacy. But the benefits are showing up in real time. It's already a powerful tool at work and at home, whether you're learning new skills, writing emails, or planning trips. Now, a new trend called the AI Health Copilot is using your medical records, wearable data, and daily habits to give personalized, proactive insights about your future health. Instead of reacting when something goes wrong, it helps flag issues early on. I spoke with Generation AI author Matt Britton, who calls the AI Health Copilot the #1 wellness trend of the year.
The reason that doctors make recommendations on actions you should take about your health is based upon data, right? It could be data like blood test information or finding from an MRI or an X-ray or even family history. And in the past, we would rely on a doctor to analyze that data and more often than not use their memory to come up with a recommendation on what you should do. But obviously humans are flawed. And that same doctor that you're relying on to analyze the data has 7 other patients in the waiting room. One thing AI does incredibly well is analyze data. And it's also able to maintain memory on your personal history and the conversations you've had with it. So all those things combined make AI a really powerful tool for analyzing health data. And that could be data from tests, but that could also be data from things like your Apple Watch or your Wi-Fi scale, and making health-based recommendations on what you should do next.
How is using an AI Health Copilot better than just simply jumping on the internet and Googling something or scrolling through WebMD?
Well, that would be like, what's better, talking to a stranger on the street about your health or talking to a doctor? Like, when you create a custom GPT, it has context of all your personal information. It's not just when you go into Google and you ask information, it's treating you like billions of other people on this planet without any context of who you are. If I'm asking a custom GPT information, it is specifically trained on all the information about me and my history, and then will give a response that is custom built based upon that information.
How will AI continue to be put to use in healthcare? In addition to this Copilot, is it going to replace doctors and nurses someday?
Well, I think there's certain things that doctors and nurses do that they don't need to be doing anymore, like writing prescriptions, for example, or booking people's next appointments, right? I do think that the higher value, more human aspects of being in terms of talking to people about their health and the long-term choices that they need to make and dealing with some of the mental and emotional repercussions of the ailments that people face will always be a role for a human. But when you look at something like a radiologist who reads an X-ray and essentially just looking for patterns, over time, you're talking about AI doubling in its power and potency every 7 months. So that means 3 years from now, it's going to be at least twice as powerful. Your doctor is not getting twice as good in the next 3 years. In many cases, they're getting slightly worse over time because we have that kind of cognitive decline. So I think over time, you're going to see more and more functions of healthcare be driven by AI. And of course, there's lots of questions about privacy and accuracy and all those things. But, we were once at a point where people never thought that individuals are going to be posting out their vacations or pictures of their kids on social media. And now that's all we see. I think over time, we become desensitized to some of those issues if we're getting value on the other side. And I think there's a tremendous amount of value to be gained, especially in a world of rising healthcare costs, by implementing AI into the way that you look at your health.
That's such a fascinating conversation. My thanks to Matt Britton. Tomorrow, I'll share the second half of our conversation, looking at the broader impacts and concerns around AI in the workplace.